Welcome to Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware Healthcare Reality.
Hi, this is Dr. Nick Biasotto, the host of the Medical Society of Delaware's podcast, Delaware Healthcare Reality. We have a very interesting topic today, but before we begin, I'd like to do a little bit of housekeeping. I'd like to give very, very much thanks to our supporters and sponsors, and they include Peak Technologies, the DHIN, which is the Delaware Health Information Network, Platinum Dining Group, Source Pass, and WSFS. The opinions in our podcast do not reflect the Medical Society of Delaware's endorsement of any product. It is strictly for informational and educational purposes only. We have a very interesting topic today. It's about the full body magnetic resonance imaging, which is the MRI. We are going to talk today about a total body MRI and its ability to detect cancers in the body before they hopefully get out of hand. So what is the Prenuvo test? The Prenuvo test is a whole body MRI scan which can serve as an adjunct to, but is not intended to replace the established evidence-based screening practices for early detection of specific malignancies, such as colonoscopies, mammographies, pap smears, low-dose CT scans for the lungs for those at high risk, and PSAs as a prostate cancer screening. It is effective for visualization of solid lesions 1 centimeter or greater within the head, neck, chest, abdomen, and pelvis. Like any medical test, there are limitations which make it impossible to detect all malignancies and disease conditions. It is sensitive and specific for the detection of cerebral aneurysms 3 millimeters or greater. It does not evaluate cardiac vessels. It does not evaluate pulmonary micronodules. It is limited in its evaluation of the GI tract, such as polyps within the colon. It is not tailored for detailed evaluation of joints, such as knees, cartilage, ligaments, etc., and is not considered a primary screen for skin cancer. Now, our guest today is Dr. Shannon Ashley. Dr. Shannon Ashley, I will refer to her as Shannon, is Senior Preventive Medicine Physician at Prenuvo. She leads the strategic and clinical direction of the preventative team across North America for the Prenuvo company. With a focus on early disease detection and personalized health recommendations, she ensures that the highest standard of care through evidence-based practices, comprehensive risk assessments, and AI-generated enhanced diagnostics. She also drives physician performance, develops standardized workflows to improve the patient experience, and ensures medical regulatory compliance across all jurisdictions. She received her MD degree from Boston University School of Medicine. She did a residency in family and preventive medicine at Emory University School of Medicine. She is board certified from the American Board of Family Medicine and is licensed in the state of Georgia by the board of the state. Welcome, Shannon. How are you today?
I'm doing well. Thank you, Dr. Biasotto. I'm glad to be here.
Okay, I'm going to ask you a few questions. First question. What are the pros for total body MRI? The pros.
I think the biggest advantage is visibility. So, as you described very well, what our screening MRI is able to do is that we're able to look across multiple organ systems in a single session without radiation, and then potentially identify things before they cause symptoms. So for patients, who are seeing more of these unexpected health stories, they can feel like a way to be more proactive and informed, I think, rather than waiting for something to happen.
Well, the good thing is there's no radiation. These CT scans, PET scans, and the like really add up those radiation effects over time. There's obviously no contrast, correct?
Yes, yeah, and that's a choice that we make. We want to keep it like no risk coming into doing this. We also don't want that limitation on how frequently someone may want to do a scan by not having contrast or radiation involved.
Got it. How long does a scan usually take?
So for our standard whole body MRI, generally speaking, the time slot is an hour, but most people spend about 45 minutes in the scanner.
Okay. And I guess a lot of people want to do this because of peace of mind. For example, family history of cancer. There are some genetic cancers that, they're always worried about, such as Lynch syndrome and the like, and BRCA1s and BRCA2. So peace of mind is a good thing. Well, what about those people who just worry about everything, their health anxiety? Does this obviously put them at ease, or does it make them want to have more tests? What's your deal on that?
I mean, I've dealt with that, in the traditional outpatient practice that I've done, and then to my surprise, almost is a good niche of patients that are going to come through Prenuvo, because this is giving them that opportunity to sort of investigate more on their own, outside of maybe what they're being told in practice. But I think for many of those folks who maybe have a laundry list on their medical intake form coming in, there be some reassurance that we're able to provide. It may solidify other, individual tests they've done along the way. But certainly I'd say the person that, we want to make sure we're having maybe deeper conversations with would be anyone that wants this to be like an exact science for them, or that they're going to get exact answers. That's where there'd probably be more of a concern in somebody that wants the certainty, complete certainty.
Got it. Understand. Okay, Shannon, now you've gone through some of the pros of the testing. How about the cons and the limitations? Could you elaborate on that?
I guess I would say that the trade-off is that when you look more broadly, you'll find more. And so some of what you may find may not be clinically significant, but still requires interpretation and sometimes a follow-up. I think that with traditional imaging, sometimes people are going to refer to things as incidental findings or incidental MS because the scan wasn't originally intended to look for them. So in the context, we are intentionally looking, taking a broad look, I should say. And so the goal isn't to ignore those findings, but to classify and manage them appropriately. So the challenge isn't that we find the things, it's knowing which things matter, which don't, and how to guide patients without overreacting.
Got it. So you do get some false positives, I'm sure, that leads us to maybe going down the rabbit hole, so to speak, forcing biopsies that may or may not be necessary, or doing further testing with, localized to the area. What do you think about the false positive issues, and is it a problem with your testing?
I think that we match up to standard outpatient imaging in regards to the amount of follow-up that would occur based on findings. We spend a lot of time making sure we have a good comprehensive understanding of some of the kind of middle ground findings that there are, so that the providers like myself on the back end at Prenuvo are able to talk and sort of walk the patients through what we would consider best next steps. And so it's important that we set those expectations, because not every finding is dangerous, but not every finding is trivial either.
What about the cost? That's a downside, I understand. It's a little bit pricey. Tell me about that.
That's where the greater goal of coverage is down the line. But for the cost, we do is what we can to try to, make it available through FSA and HSA accounts for folks.
So you can get them out of their health savings, okay?
Yes, you can. Mm-hmm. Yeah, yes, you can.
And do you anticipate potential future approval from the FDA so that it may be incorporated in CMS's program and commercial insurance will pay?
I think that the FDA question is a big one. It's an important one, but there's a lot of confusion around it because whole body MRI screening as a concept isn't something that has specific FDA approval. People think of that like with the drugs or single tests. So MRI machines themselves, right? Those are FDA cleared as medical devices, and the imaging sequences are established. But using a whole body is for asymptomatic individuals is a matter of like long-term clinical application and evolving evidence that we're working to sort of prove better utility over longitudinal studies that we do.
Okay, what's the average price if I want to go get myself a MRI?
The average price for the whole body scan is around $2,500.
Okay, does that vary from section to section of the country, or is that's about it?
No, I can speak for the U.S. and I believe comparable in Canada. We then have a focus scan, which is going to be more concentrated on the areas where more cancers tend to grow. So it's almost like if you're divided, say it's like a almost head and torso area of the body.
Mm-hmm.
That one is at a lower price point. So that one sometimes is a good introductory scan for somebody too that kind of wants to get used to what it's like to go into a scanner. It's going to be a bit shorter overall, so there's a couple advantages for someone that might be new to the scanning option as well.
Okay, so you may get some also false negatives, missed problems and things like that, just like any test. I guess that's something that you cannot help because all tests can have a false negative, some tests have a false positive. But I understand it's a lower resolution than a targeted imaging process, so that you're more concerned about detail. The whole body scan trades detail for coverage. Is that a way to put it?
Yeah, I think that's a fair assessment.
Okay. Let me ask you this. Who might be the ideal candidate for Prenuvo? The total body MRI?
Yeah, that's a tough question to give a single answer to. I would say, based on what I see on my end, the folks that you could divide it into, based on where I'd say stages of life. We get a lot of folks who are, say, in my age group, anywhere from 35, 55, and it could be driven from knowing that all of your energies aren't necessarily going into your own personal health care, and that needs that reassurance layer to understand that you can have focus on a lot of things because maybe there isn't so much going on, or that you need to, get some time kind of scheduled away so that you can be working on your own personal health care. But I think anyone that really wants to, kind of match up where their long-term health is with a lot of the same things that we are actively every day working to do. So we work to make money so that we are financially secure, so that we can retire. And so I think what retirement should look like is also good health. And so we need to kind of have that matchup. So I think it's good for anyone who's looking to have that whole big picture at the end of the day.
Got it.
In terms of longevity.
Got it. Well, I guess if I had a strong family history or a genetic predisposition towards a certain types of cancer, I would certainly want that test. And if I had enough income to do it, I would do it, just for those reasons alone.
And that's a good point. That's another really great, example of the people that come through. Many of them will have a stronger family. Some of them will have a strong family history of cancers, and that drives them to want to go ahead and get that earlier screen. There's going to be a lot of women have different reasons that they may want to get evaluated just based off of sort of more generalized and sometimes lack of conversation around their hormonal changes they go through different phases. So there's definitely going to be situations, I would say, instead of an ideal patient, there's personal situations that are going to drive someone towards this as well.
Okay, we're going to continue this, but at this point in time, I think we're going to take a short break. We'll be back shortly.
A special thank you to SourcePass for sponsoring today's podcast. Healthcare organizations face immense pressure, ranging from aging IT infrastructure to complex data privacy laws. SourcePass provides healthcare-focused IT solutions designed to overcome these hurdles, enabling you to deliver high-quality patient care with confidence. SourcePass is transforming how businesses experience IT. As your managed service provider, MSP, SourcePass delivers far more than tech support. SourcePass helps all their clients align their technology with their business goals to best mitigate risks while unlocking new levels of efficiency. Whether you're a fast-growing startup or a well-established practice, SourcePass provides the expertise, scalability, and human touch to help you thrive in a digital-first world. Whether you're located in Wilmington, Dover, Newark, Middletown, or Rehoboth Beach, SourcePass local teams are ready to support your success with flexible, secure, and business-aligned IT solutions. A proud corporate sponsor of the Medical Society of Delaware, learn more about why SourcePass is the best choice as your IT partner at www.sourcepass.com. SourcePass, excellent service, strategic guidance, delivered with innovation.
Now, what does the American College of Radiology say about this routine screening? Have they an opinion? Have they said anything?
I'd say that's a good question for our radiologists as a company goes. We do follow the American College of Radiology recommendations based on findings that we see, but there's lots to be said and ongoing conversations in regards to their opinions on whole body MRI.
Got it. When I order MRIs in my office for whatever reason, joint, whatever, people all tell me I have claustrophobia. Do you have an open MRI or do you have a regular MRI? What is the body scan setup?
So we do, it is going to be closed and more similar to the closed MRI. However, we are doing a lot of more kind of high-end touch points that sort of would help reduce some anxieties. And many of the folks that come in telling us they have it do feel more comfortable. That's going to be based on the headphones that we're using to sort of help cancel out noise. They can choose from either watching Netflix through a personalized design like screen that they get, so that's a distraction point. If they didn't want to actually visually watch a movie, they can also listen to podcasts or music of their choice, and so that can help very well. They have full-time interaction with the MRI tech who can speak to them throughout the experience. So I will say, and the temperatures are generally going to be modified to make sure that someone's not getting too hot or cold. And so that does make that experience a little less jarring.
I understand. I used to be the director of a chronic wound care center and hyperbaric oxygen center. And our chambers could be very claustrophobic, except they have a clear plastic surrounding and a TV on the outside so they can watch that. And most of them did not have a problem with claustrophobia, but if they did, they were prescribed I'll praise the Lamb, went in the chamber, and everybody was happy and smiling. Okay, do you ever anticipate the cost of this coming down, i.e. you getting so much business that you can now lower the price to a regular standard individual whose average income? Do you ever see that happening?
I mean, I see the signs towards that based on the way we're kind of changing our offerings and packages. We're aware that we want to kind of be able to offer this to a wider scope, so that was sort of that first step with our focus scan offering coming down on our price point there. And then we have add-on tests that are sometimes going to be insightful in more specific areas that at some point may also be what we call a la carte options. So we do have, but that may be based on having your whole scan first. That being said, we can utilize the brain MRI, and we have advanced neuroimaging through NeuroQuant, and so that's going to go, and it's like the difference in sort of getting a broad overview of how the generalized brain looks from the outside, and then going in and individually measuring very specific tissue areas for their volume based on the age and sex of the patient. Are they fitting within the sizes we expect to see, which then can be extrapolated into, is someone developing a pattern towards maybe a more neurocognitive underlying disorder like a dementia. So that's one kind of and those individual tests have lower price points because they're more specified. We've just recently started, and it's only been launched in very select areas at this point, but by this summer it should expand to most of our offices, and that's our Myo strain, which is a way to look at individual sections of heart and contractility of the muscle. It's going to provide people with the opportunity to see, do you have areas of strain that maybe altogether haven't started to lead someone into having a full, ejection fraction change or any sort of reduced ability for cardiac output, but at the same time, are we starting to see the earlier signs of it? So it's almost going to be something that has a little bit more ability for a person to work on it before you've inevitably led to like significant heart disease down the line. So that's a really exciting one. We're still like, learning on it and everything. And so it's been really exciting that we're going to have some contractility information available. And that too will be an add-on test that some folks can do down the line. That being said, we do body composition reports, which are going to be really heavily focused on a person's muscle volumes ratios to their visceral fat and sub-Q fat. And so that then also plugs into, a lot of what we could see on the whole body MRI. So we're trying to make, people have the options of what probably fits their needs at that time for them as well. Mm-hmm. And so that's something that's really, really exciting in our growth this year. So with all that kind of growth, I do foresee that things will start to be, kind of tailored into potential better opportunities financially for folks.
Do you have any success stories that you'd like to talk about? Like, wow me. Can you do that? Do you have any?
Yes, we have plenty. I'm happy to share mine. I will say that is something our website definitely has plenty of as well. But I'd say pretty, it doesn't even have to be such a big story, but impactful for me was just the idea that early on when I was first starting with Prenuvo and doing some of my original consultations, each patient I would see at Prenuvo would essentially remind me of a patient I'd seen in practice. And one really struck me because it was, a male in their late 30s who had been gifted a scan and really just, was doing it to appease his wife. Really had no thoughts coming into the scan themselves. And he says, and really, we captured what was likely a rather large, growth in the breast tissue. So it was going to be a male breast cancer case. Part of, his background history was, providing information that there had been his mother with pancreatic cancer, and the link had not really been drawn in that family. Mm-hmm. And so, we were able to, as large as it appeared on imaging, it was not palpable. He was not an obese person, so, but, it was one of those, we were catching it fairly early. He was able to then get, a proper mammogram follow-up. It confirmed that this was a cancer, and that was taken care of, through excision. And so I think that, we see those, it's more rare that we're going to have that high level of a finding. And at first, you watch a person kind of go through that, I wasn't expecting I was going to be the person that came in and actually have this finding. But very quickly, and I've had many more stories since that early time, the realization is like, this is what I did this for, because now I all of a sudden have this opportunity. I mean, I see it over and over with the rare cases of aneurysms that as much as it, is so shocking to hear, the reality is I'm telling you have one. It doesn't always get to happen. And so before anything's happened, and they're getting those fixed. And so, I think that it's both sides. It's quite an experience when those things happen.
Does a doctor need to refer to this, or can a person just call you and say, scan me?
Great question. So we have different avenues for that. So we certainly have our providers that are interested, and so they have their own kind of channel in to refer or start to partner into the company and send their patients in that way. Then we have, a large enterprise where it's going to be direct to consumer. So, Prenuvo, kind of got really popularized through social media, and so folks just heard about it. I ask that question pretty routinely in my consultations, and so it's a wide variety. Many people have heard it from their company or like through their kind of health providers. Mm-hmm. Lots of them are going to, it's becoming more popular that physicians are sort of, sending more folks, or because the people are demanding it, and now doctors are starting to kind of want to, provide that option for folks that they're asking. And yet there are going to be younger folks in particular that are hearing it more through social media, don't necessarily have an established doctor, or don't see them very often and decide to do this on their own. Very good.
Then the patient themselves would get the report if they referred themselves, or would you say, who's your doctor? We want to send this to them. What do
That's important. So they, the patients are going to be offered a post-scan consultation, and that's going to be with the providers on my team on the back end. And it's very important, especially if they don't have a provider. But that would be, another kind of person that, we'd want to have them think twice in a sense, because we want to make sure that someone is familiar with the concept that there may be follow-up needed, and they have to kind of also not only want to get a scan, but know that they may need to have, in mind that they're going to have steps to do later. And so
Further
I would
testing.
say that, we certainly offer our consultation on the back end for everybody. And that's what we push to have someone do, is make sure that they're talking through them. For more sensitive and urgent type findings, we're going to make sure that we're reaching out so that that person is notified of that, situation.
We're from Delaware here, so where is your closest scan site?
Our closest for you guys would be in Wayne, Pennsylvania, actually.
That's not too far. That's in the metro area of Philadelphia. And then you have some in New York, and I understand D.C. and Baltimore?
Yes.
Okay. All right.
Yeah.
Now,
that's
for anybody out there listening, and we have a large regular following, can you give us any information on how they can contact you, read at your website? Could you give us a website that we could go to and they could go to, and somebody to contact if they want to proceed with a body scan?
Yes, I'd say a good starting point is just going to our Prenuvo.com, where you can start to get frontline information and make your own appointments straight through there.
I'll spell Prenuvo for those that don't know how. It's Prenuvo, and that's how you can get on their website, Prenuvo.com. Enter the website and pick a site you'd like to go and get it done if you so desire. Anything else you'd like to bring up that we might not have discussed, Shannon? And it's been a pleasure having this discussion with you today. Anything else you want to add?
No, I agree. I really appreciate you having me on today and getting the opportunity to talk about Prenuvo. And we appreciate all Facebook people that give us that consideration.
We're all looking today for early detection of cancer. We have new blood tests. We have new imaging. Cancer is a big killer in America today. Many causes for that, and we can go into that with another podcast, which I think we've probably done in the past. But out there, everybody, there's ways to see and early detect cancers if you possibly can. Keep up with your regular screening exams. Do not forget that. This is not the end-all, be-all test, nor any of the blood tests that are offered out there either. So anybody out there that wants to participate in being a subject for a total body MRI, please go to Prenuvo.com and look up what you need to do. Now, this is Dr. Nick Biasotto. We've had an interesting discussion about the total body MRI here today through the company Prenuvo. Again, thanks for listening. Talk to you later.
This has been Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. The executive producer of Delaware Healthcare Reality is Mark Thompson. Delaware Healthcare Reality is produced by Tom Mitten. For the Medical Society of Delaware, I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the host or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.